So all I heard is living it up.
Beautiful shot of the White House. Welcome back to CBS Mornings. The White House is getting a new COVID czar. President Biden announced that Dr. Ashish Jha will take over when Jeff Zients steps down next month. Now, this comes as a number of new COVID cases in the U.S. plunges, but China and other parts of Asia and Europe are seeing an uptick. Dr. Ashish Jha is a dean of Brown University School of Public Health for now. We should say congrats is in order to you, Dr. Jha, as you start your new job next month. Very, very excited about this for you. And for us, actually, because you've been a regular guest here. But this is what I'm wondering how you're feeling, because word was just announced that they've just stripped some of the government funding in the COVID bill. So what's it like taking over when you're hearing your budget's going to be cut, number one, and what's your top priority?
Good morning, Gayle. First of all, thanks for having me back. I'm delighted to be back. Look, the pandemic isn't over. As much as we all wish it were, right, we still have work to do. And the president has laid out a plan for how we're going to prepare for future surges, how we're going to prepare for new variants if we get those. And so my job is to help implement that plan to make sure that Americans are ready. And I am confident that Congress is going to support that because we really got to do this. I mean, we've got to be ready for anything that Mother Nature throws at us. And that's what's in the plan, and that's what I plan to work on implementing for the American people.
Dr. Jha, when it comes to these new variants and subvariants, the ones that are out there, are there ones that you're concerned about? Should we expect what we're seeing in Europe, a spike, to be showing up here in the weeks ahead?
That's a great question. So BA.2, the one that's starting to circulate in Europe, it is actually here as well. About 25% of infections are BA.2. Look, what we know about BA.2 is it's a little bit more transmissible, but our vaccines work really well, particularly if you're boosted. So anybody who's not gotten boosted needs to do that. I think if we do that, we may get a small surge, but it's going to be kept to a minimum. We're going to be able to get through this. The key here is to watch the data and to make sure more people are getting vaccinated and boosted.
You mentioned boosters. Last night, Moderna asked the FDA for emergency use authorization for a fourth vaccine. That would be a second booster. I know that's the CDC's decision, but how are you feeling in general about the regularity or possible annual dosing up of vaccines?
Yeah, it's a great question. Look, we have always wanted to be guided by data on these things. We were when the first booster was rolled out. We've got to see what the data says on this. My guess, based on the data that's out there right now, is I can imagine for high-risk people that a second shot will be useful. But again, let's look at the data. Let's have the FDA and CDC make its decision and see where we end up with the evidence on this. And really, let's try to be guided by that.
Dr. Jha, you've been very public about your belief that the way through this pandemic is for vaccinations to increase globally. So how do you see your role playing a role in that?
Yeah, if you think about every variant that has hit us, right, Alpha, Delta, now Omicron, these have all arisen from beyond our shores for both moral reasons and just for getting this pandemic under control. We have got to get the world vaccinated. So the president's plan is very clear on this, that America has to lead. I plan to do everything I can to help implement that. Until we get the world vaccinated, it's going to be hard to put this pandemic behind us.
You know, they're starting to loosen up on masking. One, how do you feel about that? And testing, should we still be getting tested?
You know, Gayle, I think given how low the infection numbers are right now, we're down, 95% from our peaks in January. I think, pulling back on mask mandates right now is very reasonable. I've been saying that for several months, still believe that. We want to have plenty of tests around for the next surge. And we want to obviously be able to be ready to put masks back on if we need to. I suspect we won't. Let's see where the data is on that. But we absolutely need to make sure we have enough tests available so if we see a future surge, we can get tests out to the American people.
All right, Dr. Jha, thank you very much. Congratulations again.
Congrats.
Good morning. Thank you. Yes.